Hello, Dr. Dan Yachter, and it's great to be with you for this week's news, views, and weekly updates. And we're going to wrap up the discussion that we've been having over the last 4 weeks, all about hormones, stress, and thyroid health and function. So we're going to wrap it up because we have a whole nother topic coming up right around the corner: diabetes reversal, blood sugar control, coming up on Tuesday, this upcoming Tuesday. And before I sign off today, I'm going to tell you about the 2 very special guests who are going to be there teaching the master class. The one person who has not taught a master class in almost 20 years, someone who is always by my side, helping me each and every day at the office. So I'm going to tell you a little bit more about that master class coming up. But before we get into that, I wanted to go ahead and wrap up the last couple of topics that I really wanted to spend time summarizing from, again, the masterclass on hormones, thyroid, and stress. And then I'm going to leave you with really the most requested information in our office, all about testing. How do you test hormones? How do you test them properly? And then how do you interpret those tests? How do you really understand what's going on with your hormones? But more importantly than that, with the data that you get after you test your hormones, what are the right strategies for you, for your unique physiology, your unique biochemistry, your unique genetics, your unique historical medical makeup? How do you apply strategies that are going to really help you move in the right direction, balance your hormones, and just feel your best? And one of the things that you need to know is that this process, once you get tested, course correcting hormones and just getting your body feeling your best, it just takes time. You know, it's not like a pill, potion, lotion, shot. Healing takes time. So we're going to talk about that. The first thing I wanted to get into is the topic of exercise and how it impacts hormones. For men and women, it's very different. And this is something that's never taken into consideration. A man, no matter what the age, well, I guess once a boy hits puberty and kind of beyond that point, beyond the age of, say, 14, 15, 16 years old. But for men in general, the level of intensity of exercise really does not matter. The more intense, really, I guess you could say the better. It doesn't really impact from the standpoint of impacting hormones or throwing hormones out of balance, with the exception of maybe burning out the body, not giving the body enough recovery time. Outside of that perspective, when it comes to hormones, in terms of testosterone, DHEA, some of the major hormones involved with male function and male health, a man can really go intense with their bodies. No matter what the age, no matter where they're at in their life cycle, you can go very intensive and not really throw hormones out of balance. So if you're doing heavy weightlifting, 4 or 5 days per week, and you're doing it every week, all year long, it's not going to really mess up your hormones. In fact, it's just going to strengthen your system. So men are very different in that respect. It's very difficult to create hormonal imbalance with even the highest level of exercise intensity. Now, women are very different, especially as it applies to cyclical women. Women who are in their cyclical years, who still have menstrual cycles, there are differences during the month where exercise intensity will have a very great impact on the hormonal balance of the body. So, for example, if you're a cyclical woman, while you're coming into really, like, I guess you could call it the second week of the cycle, the first week is menstruating. You want to call it bleeding. That's when you're, the first 3, 4, 5, 6 days menstruating. You really want the hormones to be kind of driven low and everything's kind of reset in that respect. But then on the second week, you start going through the you really start moving up where estrogen is starting to climb in the system, and you're going through this kind of follicular. You're going to move in more into the follicular stage you're going to move more into the follicular phase, which is, and I just want to kind of making sure that I'm still with you guys here. Okay. I think I may have lost you here. I was on the line, so I'm going to go ahead and start over here for those of you guys who are with me here, trying to get things rolling. I'm not sure if having a couple of technical difficulties here, but again, what we started talking about is the differences in terms of how exercise impacts hormones, and it does so differently in men and women. Exercise intensity, not so much of an issue with men, but women who are in their cyclical years, it could be a problem. If you want to keep your hormones balanced, you have to be very careful. If you're in your cycling years, you're still menstruating as a woman, exercise intensity has to vary throughout the month. So during your, basically your second and fourth week of the cycle, you can go more intense. You can have more intensity with your workouts. During the first week and the third week, you really want to let up a little bit, do more things like yoga, like walking, things that are more rejuvenative for the body, that are a little easier and lighter on the body. If you bring intensity into the body at the wrong time during the month, you can really skew the hormones and you can create a major imbalance. This is something we talk about at the master classes. This is something I work with, especially with cyclical women, one-on-one, trying to help them balance their hormones. So with that in mind, the other part of the conversation that I wanted to discuss today is testing. How do you test hormones properly? There are two different ways that we use in our office, and it's qualitative and quantitative. Qualitative meaning we use one test, which is hardly ever used in any doctor's office. It's called the Dutch test, dry urine test with comprehensive hormones. And it's a urine collection type of test where we are actually seeing the quality of the metabolic activity as hormones are coming through the body and being urinated out. How are they being metabolically processed? And in doing so, we're looking at the quality of the hormones. Along with that, we also recommend patients do blood draws, and they get the blood marker to actually look at the quantity of hormone. So you can see quality and quantity. And the way I refer to these two tests is that just having a blood draw and looking at your blood markers, which is what most doctors do, it's similar to walking past a bookstore and looking at the books through the window. That's what a hormone blood marker is like. So if you're looking at testosterone, estrogen, progesterone, DHEA, pregnenolone, progesterone, these different markers are important, but it's like looking at the books through the window, walking by a bookstore, versus having the Dutch test is like going into the bookstore, opening up the book and reading the story, right? So obviously, both are of value. You can get a good sense of the book by looking at it, but you want to also read it. And that's what the Dutch does. It reads your hormonal biography. So we do both in our office to get a global sense of hormonal balance or imbalance. And then once we have the ability to mine and cultivate all that data, then we can really put together an accurate and precise game plan to bring hormonal balance to your body. And again, it doesn't happen overnight. There's a process to it. But again, it's all about having the right information, designing the right protocols and strategies for that person in front of you as a clinician, that's me in front of my patient, and then tracking it and then retesting to see if we truly did clinically make those changes, create more balance, which we almost certainly know long-term that balance that it's going to create is going to lead to better health, feeling better, and just better life experience. You're going to be, if your hormones are balanced, more energy, you're going to feel better, and really your relationships going to be better. Everything gets better when hormones are healthier and stronger. So that's just one of the many tests that we offer at our office. obviously I'm a chiropractor. I work on the spine all day, but we also do, I'm a nutritionist for almost 30 years, been doing nutrition. But we also, really what I've built in the office is I have my own supplement line, and I use that because I know it's the highest quality nutrition. I use it to help bring balance to my patient's body with before and after testing. In the office, we've created a virtual LabCorp Quest where I can have any marker or any panel drawn, and I can look at blood markers, and I can do these specialty tests like the Dutch test, GI mapping, the gut mapping. I can look at all of this and really help patients on the level that they need to be helped, or they want to be helped. So I wanted to leave you with that last bit of information on the hormonal side, the thyroid side. The Dutch test looks at organic acids, which can show you deficient vitamin status. It looks at stress hormones and sex hormones, sex and stress hormones. So this is what we do in the office. We do this testing to really find out what's going on. And that's kind of wrapping up the hormone, thyroid, stress management masterclass month series here. And now we're going to be moving into diabetes reversal, blood sugar control. That's the theme. That's the masterclass coming up on Tuesday, the 18th, right around the corner. That's this upcoming Tuesday. And Dr. Leif Martenson, who's been with me by my side for almost 21 years now, and his wife, Annette Booth Martenson, both a chiropractor and a nurse, are going to be instructing that masterclass. They've got to combine over almost 60 years experience. And Dr. Leif and certainly Dr. Annette going to bring tremendous, unique insight, information to the masterclass, teaching on this topic. And it's going to be powerful. It's going to be awesome. Dr. Annette has recently gone through a major health transformation, and she's going to share with you the strategies, the technology that she's used, all the natural strategies. It's going to be a very powerful night. And I would love for you to join us, whether you're a patient or a non-patient. It's free. It's right here in the office, and you will get so much out of it, whether you have diabetic concerns or not, whether you have blood sugar issues or not. Come, learn, grow, and elevate your knowledge so you can live life without fear. When you have knowledge, you're empowered, and you can make great choices and decisions regarding your health. Everybody have a great Wednesday. Thank you so much for joining me. Be with you soon. Dr. Dan Yachter signing off. God bless.